Hi, folks. My name is Greg Turner, the Radiology Coach. My job is to demystify the enigmatic world of X-rays. Mammograms have been part of the medical culture for over half a century now. Once women reach their mid-20s, this becomes a conversation piece between them and their physicians. Mammograms can often have a negative stigma, as there is a very large percentage of patients with high anxiety. The examination itself can be overwhelming because of the required positioning sets that are mandatory for a diagnostic reading. Patients must allow specialists to extend their anatomy into a cold clamp that compresses them to the point of discomfort. Then ensues the post-examination stress, where the patient must wait for their results. And even though most calcifications are benign, and there are many opportunities for radiographic artifacts, most females would rather hear that their examination yields no findings or abnormalities whatsoever. In addition to the concerns over the examination itself and possible positive results, 8 out of 10 patients express concern over the radiation levels required for each examination. Because of a culture that can often sensationalize fear, it can be very difficult to tamp down these concerns, even with real evidence that concludes positive outcomes. That being said, mammograms are an essential part of feminine health, and even, in some cases, masculine health. Mammograms can detect even the most finite abnormalities within the breast tissue. The breast tissue, including muscle, adipose, and epithelial tissue, can all be assessed to a fair degree. Small calcifications, vascular changes, anatomical challenges, and tissue variances are analyzed and evaluated. As a woman grows older, her vascular, lymphatic, and reproductive systems may produce possible signs of maladies that are generally abnormal. This can include atherosclerosis and, yes, cancer. It is very important to catch these conditions early in their manifestation so that they can be properly ameliorated. The best tool to detect these is indeed breast mammograms. The examination itself has been described by patients as mildly uncomfortable to slightly painful. It all depends on the patient's anatomy, their ability to position themselves, the type of equipment, and the necessary images needed for an adequate study. The exam lasts for about 5 to 10 minutes. Imaging professionals that perform these examinations have undergone a 2-year training program and usually undergo an extensive in-house training from the sponsoring medical establishment. Depending on their age and condition, females are recommended to have these examinations every 2 to 5 years. This should be determined by a certified gynecologist. It is advisable that women try to keep the same physician if possible, as there are many factors in making this determination. Regarding a mammogram diagnosis, the mammogram should not be a source of fear to the general population. They are merely a diagnostic tool that is intended as a preventative tool. 90% of all mammograms yield no significant diagnostic changes at all. And of those, even smaller percentages reveal changes that warrant concern. In fact, according to the Mammo Press at themammopress.com, 10% of all women undergoing mammograms will be asked to return for additional images. This is simply designed to thoroughly evaluate every nuance and suspicious area. Of those 10% who return for additional pictures, only 15% will be required to undergo a biopsy. To be thorough in our explanation, of that 15% who undergo biopsies, only 25% will experience a form of breast cancer. In other words, of every 1,000 women screened in the United States, only 5 cancers will be detected. Many women experience lumps or nodules in their breasts at one point or another. This is often normal and can be remedied with dietary changes. Coffee, as an example, can be a significant factor in the development of nodules. By merely eliminating or cutting back on coffee, patients may see significant changes. Nonetheless, Lumps do not equal cancerous findings, and nor should they. The primary issue that can arise are calcifications. Calcifications in the breast can represent a number of causes, but to put it into perspective, when a person develops atherosclerosis or hardening of the arteries, they will quite possibly demonstrate these calcifications in the breast tissue, as arteries supply blood within them. If an exam yields calcification, it is important for the patient to understand that these findings are more than likely normal in the aging process, bar some circulatory conditions. If a biopsy is necessary in order to determine the makeup of the tissue surrounding the calcification or finding, this is merely another diagnostic step required to answer questions. As to exposure limits of mammograms, a standard screening represents 0.4 millisieverts of exposure to a patient. To put this into context, the general public is allowed up to 10 millisieverts annually. On the scale of exposure, individuals are only experiencing a fraction of that allowed dose annually. In this case, 1/25th. Therefore, it is possible to have multiple mammograms in a single year, but certainly not recommended. Let's further correlate the radiation exposure to cancer-causing risks. When a person reaches 1,000 millisieverts of exposure, they are regarded as having a 5.5% chance of developing cancer. This can only be concluded that developing cancer from 1 or 2 mammograms is virtually impossible. All this being said, many doctors will draw the line at 3 annual examinations, but there are cases where more are necessary in order to effectively treat patients. Mammograms are a safe tool utilized by medical professionals to properly care for patients and their conditions. As most professionals will indicate, it is wholly understandable that general clientele experience fear and anxiety. However, in all reality, this is usually overreaction to predisposed ideas and norms. We are not denying that mammograms can reveal dangerous conditions, but rather we advocate that fear should not drive attitudes and concerns. Talk to your professionals and research for yourself if needed, and continue to watch additional episodes here on our YouTube channel. That concludes this segment on Should I Be Nervous About Mammograms? If you like this presentation, please select the subscribe button below this video. You can also tap the bell next to it so that we'll notify you when other great videos have posted. My name is Greg Turner, and I'm the Radiology Coach. And remember, mark my word and mark your films.